Another group of patients we perform buttock augmentations with silicone implants are male patients. Usually people hearing about this for the first time find it very strange, like how come men enlarge their butts, why would they even do it, and so on. Now, in this surgery, cases involving males really bring out good results. But what kind of males? Usually be bodybuilders. These patients come to us like this. Their body is all trained, the pectoral muscles come out nicely, the arm muscles, the triceps, biceps are perfect. The patient is developing their abs, but somehow they haven't been able to develop their glutes. Now, when such patients came in, we see that their bodies are great. They turn sideways and show their hips. It looks like it was taken and edited from someone else, like it's taken from a slim person. Honestly, performing buttock augmentation with implants on these patients actually complete their body to an incredible extent. I felt that with the patient I operated on for the first time. We analyzed the patient, took him to his room. Of course, he's lying facing down on the stretcher, hips facing up. As they took the man to the bed, I saw the whole silhouette from the side. At the moment, I realized that we had completed the missing part of that man. I think of it like a puzzle. We completed the missing piece of the puzzle and put it in its place, like a finished painting. Now, the hip being pronounced and distinctive in a patient also completes the wholeness of all other muscles of the body. I give this as an example, Michelangelo's statue of David. Now, Michelangelo's statue of David is extremely beautiful. His muscles are pronounced, his anatomy is great and so on, but he also has hips. So even though he's a man, he's a sculpture with hips and it is very beautiful. Take the hips of this statue, the statue of David, and there will be nothing left. No beauty will be left. It will be incomplete. So in these patients, buttock augmentation may be necessary. The patient couldn't develop that muscle. The first thing that came to my mind, this patient was on the stretcher, and when I saw him from the side was this. The man, I said, has turned himself into ancient Roman statues. Very beautiful. Now, these patients have a couple of attributes. First, the prosthesis should not be too large. That goes without saying. It should complement the image a bit, a little more pronounced. Also, these implants will protrude backwards at the hips. They will not grow to the sides. In female patients, for example, we do fat injections on the sides and hips. We make the hips a little rounder and more feminine, but in men you shouldn't touch the sides. Especially on the side, there's a slight depression called the hip dimple. This part must be preserved. It shouldn't be inflated. If you do any reach on that side, it will be feminine and not look good at all. That being said, if you are doing this surgery on athletes, I have to add this. They need to stay away from heavy exercises. They need to stay away from heavy exercise for about 2 months. This is because the implant is an intramuscular surgery and a thick muscle tissue. This muscle needs to rest for 2 months so you don't do any sports. The fact that hips in men are attractive to women, something not mentioned that much. It is something that people don't think much or talk about, but it's a fact. Male hips are attractive to women. That's a yes. In fact, I give this example. Look at the movies of some actors, Hollywood movie stars. For example, Kevin Costner shows his hips almost every movie. I cannot remember any movie in which his hips aren't out there. It is probably because the man, I guess, got that written on his contract. So he really wants his hips to be seen in the movie. Other than that, there are some other actors who show their hips for the first time in their movies. For example, Arnold Schwarzenegger showed his hips clearly in the movie Terminator. Such scenes are included in the movies because they think it's attractive to women. Here I give the example for people who can't understand why this surgery is done on men. If the hip is not really smooth and protruding, the male image is a little incomplete. In general, a protruding hip is what is desired. Technically, there is not much difference between the surgery in men and women. We don't just do the fat injection part. The aftercare, the medical dressing, and so on are almost the same. There's a difference here. As I said, they should definitely not exercise for 2 months. They need to keep this in mind. Otherwise, it hasn't much to offer. I hope I was able to give you enough of my experiences. If you have any questions about these topics, you can reach my contact information on my website. At the end of the video, you will see my email address and numbers for WhatsApp. You can send a question. If your question is a visual problem, please send me a photo. If I can see it, I can answer more clearly. Be patient because there are many messages coming in. I try to answer them one by one. Sometimes it can take a week for me to reply, so I kindly ask you to be patient.